everyone here today. I'm glad that you chose to come to this workshop, which is really teaching how to teach parents to manage kids' disruptive behavior. Really what this workshop is intended to be is a summary of evidence-based practices for parenting behaviors. And I'll go through in more detail the different programs that were reviewed and the commonalities that were taken from each of these programs. And then additionally, I'm going to be giving you some background on the theoretical orientation that underlies the development or the chosen procedures in these behavioral parent training programs. So really what the intent of this workshop is not to teach you one specific protocolized or manualized treatment. You will get a manual coming away from here, which is a summary of many different behavioral parent training programs, but really is to teach you how behaviors are shaped over time, how to work with parents to change their kids' behaviors, what are the things that we know from the science of studying behavioral parent training, what do we know about how behaviors change over time, and then to take what we know and the commonalities among many different manualized programs and present them to you in, for lack of a better term, a generic way. So really making sure that you understand the components of different parent training programs so that you can either use this as a supplement to other parent training programs in lieu of other parent training programs, or use modules of it to fit the needs of the particular families that you work with. Because I'll be presenting a wide breadth of different skills and different strategies that you may want to work, may want to use with different families that you have. But just as we know every family is different, probably in some ways every prescription for parent training is going to be different. And we're going to have some families that really need more time developing positive relationships with their kids, while others master that skill really easily but need more help and consistent discipline. And so I hope what you can take away from this is a sense of what each of these components are, and then be able to say, to make your clinical judgment and clinical decision about how to apply these strategies with the families with whom you work. So I hope that my goal for this workshop is aligned with your goal for the workshop. And certainly, if it's not, please let me know at break so I can make some adjustments to fit the needs and fit the reason why you came here. So behavioral parent training. Many of you were in the keynotes yesterday and you were able to hear Chuck Cunningham in his beautiful review of behavioral parent training programs. And behavioral parent training really stemmed from multiple original sources. So from Connie Hamp's work, from the work of the Oregon group who was studying social learning and social behavior, really directly in some ways from Skinner, and very much popularized by more recent researchers like Forgatch or Patterson, who really studied how families interact with each other and how children can influence their parents just as parents can influence their children. And so to be clear about the framework that really constitutes what's evidence-based in changing kids' behaviors, taking a behavioral approach. So teaching parents how to change their behaviors and how to work with their children to change children's behaviors over time. So all of the framework that we'll be working within is a behavioral parent training approach, which is really what is also known as social learning theory. And it's the underlying premise is that we are going to teach parents how to teach their children, but also respectfully understanding that children are going to reciprocally teach their parents and shape their parents' behavior as well. The other thing that we're going to go through is the commonalities of many publicly available manualized behavioral parent training programs, like Families and Living with Children by Gerald Patterson, Helping the Non-Compliant Child by Forgatch, Incredible Years by Carolyn Webster Stratton, the Community Parent Education Program by Chuck Cunningham, the MTA Parent Training Module, which is a large-scale study, and parent training was one component of the psychosocial interventions that were provided for kids that had attention and behavior problems. And so we've reviewed all of these parent training programs to pull out the commonalities and the kind of essential ingredients of each of them to make sure we give that information to you. So then we'll move into what are those effective ingredients of behavioral parent training programs, and then finally move into sessions. And when we present sessions, I'll present them to you in a linear way, so as if you were going through a parenting curriculum. But as we're going through this, I do hope that you will ask questions as they arise, and you'll clarify, do sessions have to be presented in this order, or what would your advice be about if I wanted to switch this session with this session? Is this a session that can be repeated? How do you make that judgment? Because I think that information is probably what's most useful for all of you. So as we get into the sessions later into this 2-day workshop, please don't hesitate to clarify questions that you have, or to clarify any concerns that you'd have. I'd really, really welcome that. All right, so social learning theory. Many of you are probably familiar with this, but I want to make sure that we're on the same page in terms of the language that we're using as we go forth into the workshop sessions. So social learning theory, quite simply, is that people teach other people. And specifically in the context of the family, children are going to teach their parents and change their parents' behavior, and parents are going to influence their children and change their children's behavior. And I think that's pretty obvious. We know that happens, but knowing that and knowing that knowledge helps us to use that strategically. The other thing that I want us to be clear on is that from studies of learning and studies of behavior, we do know that changing parents' behavior results in changing kids' behavior, and changing children's behavior results in changing parents' behavior, but the changes are not very dramatic. They're small and incremental, and they change over time. And the fourth important point that I want to make is that the changes that we expect to see within the family context can be pro-social or positive, like teaching kids how to be more affectionate or to have a more warm, engaging nature with their parents. But the changes can also be unintentionally problematic. So we can make certain situations worse, or parents can, by their own behavior, exacerbate some problems that already exist. And I want us to be clear that that can happen, so we can do our best as treatment providers to help to guide parents away from unintentionally creating a more problematic home environment. One quote here is that both pro-social and problem behaviors are taught by people close to you. That's a quote from B.F. Skinner, but again, it underscores the importance of when we're talking about changing behavior, I don't want us to get lulled into a sense of complacency that by doing all of these things, we're going to perfectly and magically create a positive home environment for families and for kids. We're going to be changing behavior over time. And I want to make sure that we're appropriately and readily talking about how behavior changes, so that way when you're working with families, if you see problematic behaviors start to arise, we know that that's a possibility and we can intervene swiftly rather than just blindly following course and not knowing when to change course. Okay. I wanted to quickly cover ways that we learn, and specifically ways that most kids learn, because this concept is expressly important in implementing behavioral parent training programs. And we can learn, and we do learn, a number of different ways. So we learn to respond quite instantly to different stimulus in our environment. So if we hear a loud bang, we might startle. And once that happens once, it's more likely to happen and to happen automatically. We can also learn from observing others, so from having the behavior modeled to us. But in behavioral parent training, what we tend to most typically operate upon is operant conditioning, or teaching kids and teaching parents how to change their behavior based upon the operations that exist in the environment. And I'll clarify what I mean by that. And a good way to remember operant conditioning and the principles of operant conditioning is to be familiar with the ABCs of behavior. How many in here are familiar with the ABCs of behavior? Many of you. Great, fantastic. So I'll go through this, but I'll be somewhat brief with it. So in the ABCs of behavior, what does the A stand for? The antecedents. And tell me what the antecedents are. Could be what triggers? Preceding. So anything that's preceding the behavior that may influence the behavior. So in some cases, it can be a trigger, or it can be something that we can learn to identify that's likely going to prompt a behavior. But really, it's anything that's occurring before the behavior that's likely to influence it. So the stimulus, the setting, the context, anything that's likely to influence the behavior. And when I say influence the behavior, I mean positively or negatively. So if A stands for our antecedents in our ABC model, what's B? The behavior, exactly. So B is the behavior, which is really the act itself. Positive or negative, intentional, unintentional, it's the act itself. And finally, C is consequence, which is anything that happens after the behavior has occurred. And when we're talking about consequences, we're going to clarify the difference between consequences that strengthen a behavior and consequences that weaken a behavior. And I want us to be clear about the difference between those two. But at a general level, a consequence is anything that follows a behavior, an event that follows a behavior, regardless of whether it strengthens or weakens it. Okay? The other thing that I want to point out here is that oftentimes when we conceptualize social learning theory or the ABCs of behavior, we tend to look at it linearly or in a line. So A happens, B happens, C happens. But and again, I think this is implicitly known, but I want us to be clear that in reality, that's very seldom a linear process. Really, A is happening, which might influence multiple Bs or multiple behaviors, which is then causing several consequences to happen. And those consequences can reinforce the behavior that was happening or cause it to happen. Really, what I'm trying to say is this happens more cyclically than it does linearly. So as we're learning it, and oftentimes as we're teaching it to parents, we tend to present it linearly for understanding and for making sure that we are clear on the process of what might be happening. But in actuality, it doesn't happen that seamlessly. And again, I'm seeing a lot of head nods. I know that you're probably realizing that. But I think it's important to realize that in the context of working with parents. So as we're helping them to solve problems, we ourselves aren't getting stuck in this linear process. So I want to go through and clarify a few things about ABCs of behavior, again, to make sure that we're speaking a common language. So the first for antecedents. Antecedents can be setting or events, prompts, or discriminative stimuli, So setting and events, that's pretty obvious. The setting that the child's in, the circumstance that's occurring. By prompts, what do I mean by prompts?
Like he said, do you have a handout? Johnny, do you have homework today?
Right, anything that might be happening before the event or the behavior that's going to serve as a cue to prompt the behavior. So I realize I'm using prompt to describe prompt, but really it's anything that's going to cue it.
Cue it.
Yeah.
Can you give an example?
I could give an example, and I think the great one that you gave is if the behavior that you're trying to elicit is, for instance, Johnny getting to work. One prompt might be, Johnny, I just gave you your paper and I expect you to go to work. So even though the behavior of getting to work hasn't happened yet, we're letting him know explicitly what we want the behavior to be, or we're trying to cue the behavior. And then discriminative stimuli is really antecedents that are going to help one to distinguish when they should and shouldn't respond to something. So what might be an example that you can think of discriminative stimuli? Yes? That's a great example. So if the behavior is coming to eat, bringing the food out to the table might help one to discriminate when to or when to not go to the table. So going to the table when there's not food out to eat is not likely to produce the behavior that we want. Going when there is might help to produce the behavior. Or why don't I answer the telephone all the time? Because most of the time someone's not there. When it rings, it might cue me or help me to know my environment has changed and now I'm going to produce a behavior. So knowing how to discriminate your environment or the stimulus in your environment helps us in some respects to prompt or to cue behavior. Are these three things clear to others? Okay for me to move on? Okay. Okay, so just to go through a bit more detail, for setting and events, I want us to be clear that when we're talking about setting and events, it's really anything that's going to change or influence the value of a consequence or the likelihood of a behavior occurring. So again, it could be a warning, like the bridge is out. It could be a satiation state, like you're hungry or you're sleepy, but it's anything that's going to alter or influence the likelihood of a behavior occurring, or in some ways, the likelihood of obtaining a reward. So when we're talking, again, the reason why I want us to be clear about these things at a basic level is because when we're talking about them in an applied sense, like how to change the environment in the home to help to produce more positive behavior, I want us to be clear when we're talking about cues versus changing the setting or changing the event versus changing the stimulus that's happening. So any questions before I move on about events and settings? Okay. For prompts, and again, I hope I did an adequate job of explaining this earlier for your question, but it's anything that's going to cue or guide performance. So we were largely talking about cues or guides as prompts. We were making reference to verbal prompts, but we can also think about physical prompts, like physically guiding someone how to dribble a basketball, showing someone how to dribble a basketball, giving them verbal instruction on how to dribble a basketball. And the example here, of course, being dribbling a basketball as the behavior. But I want us to be clear that prompts can be visual, auditory, include physical guidance or physical demonstrations, anything that's going to cue someone as to what the desired behavior is or help them to get closer to that.
Would raising your voice be an example?
Well, that's a good question. Let me ask the audience. Do you think raising your voice would be an example of a cue? Some people are saying yes. Depends on what it is, tone. Yeah, again, what's tough for us to decide as behaviorists is when a cue is working and when it's not working. But at a very basic level, an antecedent is anything that occurs before the behavior that might influence it. So if raising your voice occurs before the behavior and may influence it, whether or not we philosophically agree with it, it's an antecedent. And then finally, discriminative stimuli. So an event or an occurrence, what we call a stimulus, which indicates that a behavior is likely to be reinforced. So again, echoing your great example of if the behavior is eating, which in and of itself, having access to food might increase the behavior, seeing it visually at the table might serve as a prompt that this is the time to go to the table. So that was a really great example that you provided, but really, discriminative stimuli is anything that is going to or likely to indicate that a behavior is going to be reinforced or rewarded. Okay. Any other questions about antecedents before we move on to behavior? Okay. So behavior, as we said, is the event, the occurrence of something. Whether it's a behavior we want to see, not want to see, whether we're looking at it as a physical behavior, a verbal behavior, the intention of something, the absence of something, whatever it is, a behavior is what is affected by antecedents and what is affected by consequences. So let me explain this in a bit more detail. Individuals may already perform a behavior. And our goal might be to increase that behavior or decrease that behavior. Alternatively, sometimes individuals don't perform the behavior at all, and we have to look at it as something to teach. So again, even though this is probably something we implicitly know, I want us to be explicitly clear about it and understand it. So again, as we're guiding parents as professionals, we can help them to decide why behaviors may not be occurring at the rate they want them to, or at the frequency they want them to, or may not be getting closer and closer to what they desire in the manner that they want them to. And part of that reason is oftentimes in practice, we confuse when an individual already does a behavior and how to change the frequency or the likelihood of it happening versus when an individual doesn't already do the behavior. So I just want to be clear, the behavior is what we're trying to influence, but it might be something the individual already does or something that the individual doesn't do. So when we're talking about something that an individual already does, when we move on to talk about consequences, what will be chiefly relevant is understanding antecedents and consequences and how those might shape or change that behavior if it's something that's already occurring. versus if it's something that's not already occurring or might be partially occurring, we want to conceptualize it as a behavior that has to be taught and teaching our parents strategies for coaching or teaching the behavior that they want to see. And again, the reason why I point this out is some of these strategies that we'll be going into are more skill-based learning strategies, meaning giving parents tools for teaching their kids how to do certain behaviors rather than just shaping what already exists. And so when you're working with families, I want to make sure we're clear that there are things that distinguish those and skill sets that distinguish those, so we're applying the right strategy to families when they're in need. Any questions about behavior before I move on? Yes?
I might be a little late.
No, not at all.
Let's say, just I'm picking up a behavior in the home. 3-year-old Johnny coming to school, I might be picking up a little chair, get angry and throws things. That's a behavior.
Okay, so let me make sure I just understand. So as an example of a behavior, we have a 3-year-old child who goes to school, stands on a stool, and throws things.
Little things, a little chair and throw across the room.
Oh, so he might pick up a little chair and throw it across the room. And your question is that a behavior?
I'm telling you, it's a behavior.
No, and I believe you, it's a behavior.
But you're saying in the home. Maybe I'm jumping. I just see it as alert behavior, something the child might have seen happening in the home. So from that perspective, what are we saying? We don't teach. We teach the child or the parent, you know, what the child is learning in the home. How do we approach that with the parent?
Yep. So your question is, we know certain behaviors are occurring. And whether the child's seen something, so it's been observational learning, or it's been modeled to them, or whether they've been directly taught the behavior, so it's been explained to them, coached to them, or whether the behavior just spontaneously occurred and it somehow got reinforced. Regardless of the cause, it doesn't matter that it's happening, and we need to intervene with what's happening. Is that, am I echoing what you're saying? Okay. And so it sounds like your question is, how are we to then intervene with the parents? And you know, I'm going to give you a lot of different strategies and hopefully help you to come up with a way of conceptualizing solutions. I don't think one thing that I will ever be able to do is for every individual situation that's posed to me, say this is the silver bullet, this is what's going to stop that behavior in its tracks. But what I hope to do is give us a framework for understanding how behaviors occur, how they develop, to then decide, you know, was this a behavior that was modeled? So should we teach a replacement behavior? Or is this a behavior that's getting reinforced somehow? And I'll explain what reinforcement is in a second. So do we need to reinforce a different behavior or provide a consequence? Is this a behavior that's getting a lot of peer attention? So understanding the context and understanding antecedents, behaviors, consequences, and many other important behavioral principles will help us then to make those decisions. So I don't know if I'm going to be able to give you a perfect answer now, and certainly probably won't be able to give you one by the end. Welcome to this workshop. But I hope we can create a common language and a common understanding of all of these principles so that we can work collectively together to come up with solutions. Yes?
A big part of that is observing the child both at home and at school, and when the behavior, you know, a lot of it has to do with assessment and frequency, and depending on what tool you're going to use based on what the behavior is, to see, like you said, if it is disease. And basically, you know, it could be something that's going on in the home, or it could be just at school, or like you said, reinforced by peers or whatever, or even by the parents. So, you know, but I just think, you know, I'm sure you're going to get to that, but it's going to be assessing exactly what's going on and who's really more participant. And like they said yesterday, a lot of times it's more the mothers are more involved than the fathers, and you know, so it's assessment is really important.
Yep. I agree that assessment's really important, and I think you're both bringing up a larger issue, talking about multiple settings. So you're talking about the home and the school setting. We can also extend that to the kids' social setting, or their setting in their interaction with other settings or other people. So while specifically we'll be talking about strategies that you can use with parents to change the parent-child relationship or the parent-child interactions, ultimately the child behaviors, I don't want us to operate under the presumption that any of this is happening in a vacuum. Of course it's happening in an environment where the kid's getting a lot of different pieces of information from a lot of different settings. And this one is specifically geared towards helping parents directly when they come to us for help. But many of these principles could be applied in a classroom setting. The implementation of it might be slightly different, but the principles at the core are the same. And you could look at the same core principles in a social setting. Again, the implementation for changing behaviors might be different in a social context versus a school context versus a home context, but the behavioral principles are largely similar. Yes?
I was just going to add that I work in a children's mental health agency, and what we're seeing is we don't always see sort of the purely mental health kids coming through our front door. And we obviously notice because when we try and do the behavioral work, we're getting nowhere. And what we're finding is we're starting to query more and more if a youngster is on the spectrum, if there's a developmental disability, because sometimes the interventions don't always work, especially around brain function and so forth.
Yep.
So it's a challenge when youngsters don't generalize
Yep.
their learnings and adapt in different environmental settings. So sometimes using a purely behavioral approach comes with some challenges around all those complex mental health cases that we're seeing more and more.
Yep. And certainly I don't think any of us would dispute that a child's learning style or other antecedents, be they mental health diagnoses or home settings or capacity or swiftness of learning, so the number of repetitions that they need, all of that, of course, is going to influence the readiness in which they learn a behavior. And I don't think any of us would dispute that. But again, oftentimes the strategies that we implement sometimes fail because of a lack of understanding of the basic concepts. And I'm in no way insinuating that to be the case, but just clarifying that that can often be one of the reasons why the behavioral interventions we set up, beautifully designed as they may be, when in practice don't seem to have the punch that we would want them to. And it might be because we're failing to understand other contextualizing factors, or it might be because the frequency or the intensity in which we're doing behavioral interventions just isn't enough to produce that change. So these points that you're bringing up, I think, are so valuable for us to hear because, you know, right now, the beginning of this workshop is largely making sure we're on the same page with concepts. But I do hope as we get into sessions and strategies specifically, we can work together collectively to address problems that you might be seeing with the kids with whom you work or with the parents with whom you work, so that you can take some of those contextualizing factors and think, how might they be being maintained? Or how might this behavior be being taught? Or how might this behavior be punished? And really use these principles to more practically implement strategies and to think about how can I use this with parents. Okay, before we move on to the next slide, other questions about behaviors and distinguishing a behavior that that a child may already do versus behaviors that a child may not do yet and may need to be taught. Do we understand the difference? Awesome. Okay. A few concepts that, I want to make sure we're clear of. And again, this might be largely familiar to some, but I want to make sure we're using the same vocabulary as we move forward. When we're talking about behavior, again, we'll be talking about how behavior or the event, the occurrence, what it is that we have in our linear line of ABC is affected. And we'll talk about how it's affected by antecedents, but also how it's affected by consequences. But I want us to be clear about a couple concepts regarding behavior. And the first is shaping. And I want us to be clear that oftentimes when we are trying to affect a behavior, we're trying to often affect the intensity of the behavior or the frequency of the behavior or whether or not the behavior occurs at all. And the parents with whom we're working very badly want the same thing. They want the intensity to change, the frequency to change, the behavior to start, or the behavior to stop. And in actuality, what we often see is that we get closer and closer iterations of the behavior that we want, or closer and closer iterations of the behavior that we want to stop happening over time. We very rarely get the exact behavior that we want to see or the frequency that we want to see happen readily. We see it change slowly over time. And that's the concept of shaping. Shaping is really the reinforcement, and I'll clarify in a moment for you reinforcement. The reinforcement of successive approximations to the goal. And successive approximations, I mean getting closer and closer to the desired behavior that we want to see. So not seeing the end goal right away, but seeing steps closer and closer to it. We often see the behavior that we're trying to influence via our consequences or our antecedents changing over time. And so getting closer and closer to what it is that we want it to see. But I want us to be clear that we don't often see dramatic change. We see change over time and change of that particular behavior in the way it presents itself over time. So when we're talking about strategies that involve shaping, what I'm making reference to is seeing changes in the behavior, either in the intensity of the behavior, the frequency of the behavior, or the way the behavior presents itself over time. So when I'm presenting a shaping strategy, which I will be doing, I want us to be clear, because sometimes we say, but that's not going to give us the behavior we want right away, or that's not going to stop the behavior right away. So again, I just want us to be clear about when it's a shaping behavior versus when it's a chaining behavior versus a teaching or coaching type of strategy or behavior. So shaping, is everyone clear that it's change over time and it's getting closer and closer to the desired behavior or goal that we want? Okay. Changing then is that many end goals are comprised of lots of smaller behaviors that have to happen to get to the end goal. A very easy example of that is getting dressed. To be dressed, though that's the ultimate outcome that we want, that's comprised of many behaviors. And that's a very easy one for us to understand in terms of, okay, I've got to put my head through my shirt hole, my arm through my shirt hole, pull my pants up, put my belt on, put my socks on, put my shoes on, that it's comprised of many behaviors for the end result of being clothed or being dressed. But I want us to think about chaining too in terms of more problematic behaviors like tantruming or behaving well in school or behaving well with your sibling. So the goals that parents often present to us are really comprised of many little behaviors that we need to understand and help parents to understand that the outcome that they want is often a reflection of many small changes that they want to see to get to that outcome. So helping them to understand that and understand that as professionals so we can help to show that this outcome that they want might be comprised of many behaviors that have to be taught together in a sequence or chained together. And that as these smaller behaviors we're learning are chained together, that's going to shape the ultimate outcome that they want. So we might be moving closer to that behavioral outcome by making closer and closer steps along the way. And those closer and closer steps may involve learning lots of little strategies or lots of little behaviors that comprise a larger outcome. So is it clear the difference between shaping and chaining? Any questions that I can address? Okay, and again, I don't think any of this is dramatically new material for any of you, and I think a lot of you probably implicitly know this and implicitly use it, but sometimes it's important when we're learning new strategies to explicitly have it explained and understand it so that when we as professionals are working with parents and we encounter tough spots, we can go back and say, you know what, this is changing slowly, but maybe we just need to look at it from a chaining perspective or a shaping perspective.
I think what you're doing, though, whether we're familiar or not, is giving us a very clear, structured outline. So, I thank you. I think what you're doing is really.
You are welcome. I'm glad I'm achieving that goal. Thank you for that labeled praise, which we will be bringing up in a hot minute. Okay. So now let's move on to consequences, and we'll clarify a few concepts about consequences. So first, more globally, let me clarify again what a consequence is. And I know we just talked about it, but a consequence is anything that occurs after a behavior that influences the behavior. And really, you can boil consequences down into two main types of consequences, either reinforcement or consequence. And reinforcement, though it's up there, just to clarify, is anything that increases a behavior or increases the likelihood of a behavior continuing. And I know this sounds like very obvious, but it's one of the more fundamental things that I think can go awry in our implementation of helping parents change behaviors. If a behavior is increasing, it's being reinforced. If the likelihood of that behavior happening again increases, it's being reinforced. So oftentimes parents are doing strategies, or we're giving parents advice about strategies for getting rid of a behavior. And they keep saying, but the behavior's not going away, or the behavior's getting worse. No matter how much we wanted that strategy to be a punishment strategy, if it's increasing behavior, it's reinforcement. So reinforcement, I'm explaining this kind of poorly and I apologize. Reinforcement is not just what we do after the behavior that we really want to work. Reinforcement is not necessarily a sticker, it's not necessarily a hug, it's not necessarily a high five, it's not necessarily a labeled praise. We will talk about a lot of positive consequences that typically serve as reinforcers, meaning typically increased behaviors. But I want us to be very clear that if a behavior is increasing, it is being reinforced. Yes?
Maybe if you think about it as not so much the sticker, the actual concrete consequence of that, but if you ask the question, what keeps that behavior
Going. That's a really great point. So not thinking about it as an object or something that we're providing, but what keeps the behavior going is exactly reinforcement. So what keeps the behavior going is analogous to what's reinforcing the behavior. And also to be clear, if a behavior is continuing or a behavior is increasing, it is being reinforced. Regardless of what that consequence is or what our intent is, if it's happening and it's happening with increasing frequency or continues to happen, it's being reinforced. I want this to be a very clear concept, and part of the reason why I'm going over this is, again, we will talk about positive disciplinary strategies or ways or ideas for increasing a positive parent-child interaction or a positive parent-child relationship. And though we may be very well-intentioned, there are always going to be cases where we see behaviors that we want to decrease to actually be increasing. And if we keep blindly saying, but I'm doing, I'm teaching praise or I'm doing this, without stepping back to say, is the behavior decreasing the way I want it to, or is it increasing the way I want it to, and understand it at conceptually the level of reinforcement and punishment, we might be doing a disservice to our families. So reinforcement is anything that increases the behavior or increases the frequency or likelihood of it happening. Yes?
Every so often I hear a parent will say, 3-4-year-old, I whip him or I punish him, I whip him, but it gets worse,
Yep.
And it's not working.
Yep.
We don't punish with most times smacking.
Yep.
That's what they say, I keep them tired.
And I really sympathize with parents that echo that sentiment because they are right, wrong, or otherwise, regardless, let's disabuse ourselves for a second about the value we place on rewards or the value we place on punishments. At a very basic level, if they're trying to change a behavior in their child, they're trying to reduce a behavior or trying to increase a behavior and are coming up thwarted again and again and again, it's a very frustrating position to be in. And it can result in parents feeling very disempowered, not feeling like they're good parents. Their confidence starts to wane over time, and then they might start to withdraw too from their kids because they're just not seeing the success they want. And it's really our job as mental health professionals to help parents look at those situations and say, is the behavior increasing? Is it continuing? Let's look at it from strictly a behavioral perspective to see, are we reinforcing or maintaining that behavior? Yes?
Yeah, I think there's also a tendency, if they're using what they think is a mechanism that should work, if it isn't working, to simply intensify the mechanism.
Yep.
Instead of looking, well, this isn't working
Right.
at all. Because that's the skill that they know to use.
Sure.
And they don't have another skill to use.
And we do that too. It's not just parents. We all do that. We have a mechanism of what we think works, and it's not often that we take a step back to objectively look, am I getting the result that I want? And sometimes, I think you're bringing up a great point, we are making progress in a slow way, or we're decreasing a behavior in a slow way, and we do need to ramp up the frequency or the intensity. So maintain the modality, but change the way in which we're implementing it. And that also too is a learned skill for parents and for us as professionals to know when a behavior is being reinforced versus when we need to just change the intensity of what we're doing. I know there was a question in the back, yes?
How would you differentiate between working with extinction? You know, it's like that last person trying to get the reinforcer,
Yeah.
not giving it to it, it's getting worse.
Yes.
That's going through that process, and it's really working.
And we're going to talk about extinction in just a minute. So if you'll allow me, I'm going to pause on answering that question, but you're bringing up a very valuable point. If I don't adequately address it, please raise your question again, because I think it's of incredible importance for everyone in here to think about and learn about.
I think it's important to go in with the intention that every parent wants what's best for their children. And at times, I find that parents perhaps are feeling that they are reinforcing and it's a good
Yep.
thing, but end up praising perhaps the outcome or what you call the change, the end process, as opposed to the effort.
Yep.
So, good job, you got that A, you got that A, which is reinforcing good work at school, but if the child then gets the B, it's reinforcing a negative, it's the end of the world, I got a B, because they weren't praised for the effort, but instead the goal.
Yeah. Yeah, I think you raised a lot of good points. So the example of only looking for the outcome rather than in some ways valuing the process. And you use the example of grades, but I think you can make the analogy to the parent-child interaction. So if it goes well with the parent, they may want to praise the outcome, but forget to praise the process that's happening or to value the process that's happening. And that's not saying that they're a bad parent. I think we all do that, whether it's with our own kids or with our own interactions with others. The other point that you raised is having the mindset or going in with the bias that parents are coming to you because they want to make their relationship with their child better. So though they may feel thwarted or depressed or low confidence or a number of things, if we have the position that we're working with parents to help them to figure out what works for their family, I think in some ways that's a nice position to have, because just like these are general concepts, and then the application of those concepts are things that tend to work for most kids, there's always going to be exceptions, and we have to come back to the rule rather than to the implementation of the rule. And again, though we might run into parents whose end goal is not to have a better relationship with their child, I think the more we can start from that position and help parents and really have them look at us as a guide or a coach, like they're looking at their relationship with their child as a guide or a coach, it kind of helps us to model the behaviors we want to then teach them. So I think you raised a lot of really important points. Yes?
I think if you stay with an example, and I'm going to throw some things out, and
Please do.
maybe you can respond. But I think parents sometimes can be taught unrealistically in that if my 3-year-old is jumping on the couch and I stand at a distance and I say, Frank, get off the couch. Well, there's hardly a 3-year-old who's going to hear that who isn't listening. And parents emphasize listening instead of doing. And the key point of getting a child to do is, what does it take to get a child to do? And the external world saying to a child, get off the couch, will not be enough. It wasn't supposed to be enough, because at the age of 3 or 4, children are having fun and they're excited and they're getting carried away. That's biological. So if a parent then raises their voice, which is what I mentioned, and says, get off the couch, and the kid still is in the midst of doing it, if the parent doesn't get angry, but recognizes, I really haven't even told the kid when to get off the couch, because missing in that statement is now. You follow?
I do follow, yes.
Definitely listen to the concreteness of what is being said to them.
Yep.
And if you said now, right now, and you clapped, you see, my way of thinking is that's involvement, that's not anger. That's helping the child to take you seriously. And if I then have to go closer to the child to then remove the child, that's my job to help the child do what I want of the child.
Yeah.
And if I then say, thank you, I'm not going to let you get on the couch, we've accomplished the goal. My goal, the goal of the kid was to keep jumping. I think a lot of this, you know, is so meaningful, but you know, that to me would end on a note of success, because I have recognized as a parent, what does it take on my part to help this kid do what I want?
You know, I think you're bringing up a couple of points, and one is taking these concepts and then teaching the application of them. And the application of concepts is going to look differently, family to family and situation to situation. And I also don't think we can separate ourselves from the equation. As therapists or as mental health counselors or providers, we're working directly with the family, and so our interaction with the family is also going to shape the way they interact with the family. Again, before we get too much into implementation, I want to make sure we do have that common language of behavioral principles, so that as we're developing the implementation of those principles, we're keeping in mind what affects learning for most kids, and how do we know when learning is happening. I think the other point that you brought up is that we have to honor developmental considerations. So even though the core principles may be the same, the way I would teach an adult is going to look dramatically different from the way I'm going to teach a child. And the way I teach a 3-year-old child is going to look dramatically different from the way I teach a 13-year-old child. The degrees of difference are also going to be apparent in the families that I'm working with. So one 3-year-old child might be coached differently than another 3-year-old child, and one 13-year-old different from another 13-year-old. So before getting too into specific strategies for implementing these principles, I'm going to take it back for a second to make sure we're again on the same page with the principles. But yes, sure.
What you were just saying, making sure it's reinforces, but also includes things like it being enjoyable being on the couch is a reinforcer. I think it's not just praises, as well as daddy screaming at me and I get attention is a reinforcer.
Yes, we're all raising really, really valuable points. And again, I'm going to pause on questions just for the moment in the interest of time and keeping us on schedule, and come back again to core concepts. But I can already tell and am encouraged that there's going to be a lot of conversation and a lot of working together when we talk about the specific skills and how to implement them. And I hope that you'll all help each other as we're working in groups to remind each other of these core behavioral principles as we're talking about the application of them, because there's going to be a lot of ideas generated, and part of deciding what's an appropriate idea to help a family implement is going to be understanding it in the context of changing behavior over time, and we can be resources in doing that. So we've talked quite extensively about reinforcement, and I want to make sure we're clear that reinforcement is anything that increases a behavior or influences the likelihood of it happening again. Any question about that? So again, punishment, or the contrast of that, is anything that decreases a behavior or decreases the likelihood of a behavior happening again. So again, we must look at it from that objective standpoint. Punishment is not something that we want to stop the behavior. Punishment is something that stops the behavior or decreases the behavior. So looking at it in an objective way, is the frequency of the behavior decreasing? Is the likelihood of the behavior continuing decreasing? If so, that behavior is being punished. If not, the behavior is not being punished. Is that distinction between reinforcement and punishment, clear? Okay. I want to highlight a few more points about reinforcement. So again, reinforcement is anything that's increasing behavior or increasing the likelihood of a behavior. But I want to make the distinction between positive reinforcement and negative reinforcement. Positive reinforcement is not the subjective quality of the reinforcement. That tends to be how a lot of us think of it. Positive reinforcement is adding something or providing something after a behavior occurs that's going to increase the behavior in the future or increase the likelihood of the behavior. So can you think of an example of positive reinforcement? So a behavior occurs, something is added as a consequence, and that behavior is more likely to occur in the future.
The child studies for the test,
Mm-hmm.
gets an A on the test.
Mm-hmm. So the child studies for the test, gets an A on the test. So something was provided or added to the situation, the A that the child earned. So if the child increases their frequency or is more likely to study in the future because of that A, we have positively reinforced the situation. Or if a child does a behavior that we like and we add a high five or we add a praise and we say, hey buddy, I really like the way that you came over to me the first time I called you, and they're more likely to do that in the future, then we are positively reinforcing the situation. So positive reinforcement is not a subjective evaluation of the quality of what you're doing. It's adding something that increases the behavior. Negative reinforcement then is taking something away that increases the behavior. So oftentimes we might think about a child is doing something and a parent is saying, come on, come on, come on, come on. The child does it and the come on stops, or the nagging stops, and the behavior is more likely to increase in the future. That might be an example, one type of example of negative reinforcement. But at a basic level, it's taking something away that continues to reinforce the behavior. Again, I just want to be clear about it because when we're talking about positive reinforcement, one of the most common things that I hear is talking about positive reinforcement as though it's an evaluative judgment of what's happening. That, oh, I don't do this type of reinforcement, I do positive reinforcement, as though that's more pleasing to the child or more developmentally appropriate. Positive reinforcement at a definition level is adding something that increases the likelihood of that behavior happening in the future. So again, when we bring this back to skills to use with our parents and we talk the application of this, I want us to be clear about when something is a positive reinforcement strategy versus a negative reinforcement strategy, and be clear that regardless of positive, negative, if we're talking about reinforcement, we're talking about increasing behavior. Okay? Oh, almost forgot the other points I have up here. Just that social reinforcement tends to most typically be positive reinforcement. So we're adding some level of social attention or social reciprocity that's increasing a behavior. But social reinforcement is by its very nature social. So it's sharing or reciprocating with someone. Intentional reinforcement, when we talk about that, we're saying we are intentionally providing or taking away that outcome to increase the behavior. Contrasting that with accidental or unintentional reinforcement, where we may not be purposefully doing it, but something is happening in the environment that is adding or taking away something that's increasing the behavior. And I think the accidental or unintentional reinforcement is what's most frustrating to parents, is when they're trying so hard to change a behavior, to increase a behavior or to decrease a behavior, but they find that they have unintentionally reinforced it, or something else in the environment has unintentionally strengthened that behavior. And then finally, I wanted to clarify reward versus reinforcement. And again, we've talked about the sum, but those terms tend to be used interchangeably. But I reward my child every time they do this, and I'm still not seeing the change in the behavior that I want. A reward is something that's provided, could be tangible or intangible, but is something that's provided in exchange for the demonstration of a behavior. So it is done typically with the intent to reinforce the behavior or to increase the behavior that's happening. However, regardless of a reward being given, if it's not increasing the behavior or increasing the likelihood of the behavior happening, it's not a reinforcer. Again, this is oftentimes confused for parents, and I can appreciate that. We hear it confused in our daily language all of the time. So they might be intending to reinforce a behavior by offering a reward, but if it's not changing the behavior, it's not a reinforcer. So a reward is something provided in exchange for the demonstration of a behavior. But a reward, though we want it to reinforce, we need to look at it critically to say, is it changing the behavior the way we want it to? Intentional is I'm sorry? Intentional is I'm intentionally or purposefully trying to reinforce the behavior, versus accidental, which is I may not be intending to or trying to, but the result is I'm increasing the behavior. Okay, so again, the contrast of that, I want us to just clarify positive punishment versus negative punishment. Again, it's not a qualitative judgment of the punishment. It's, do you add something that thereby reduces the behavior or reduces the likelihood of the behavior? So what might be an example of positive punishment? A behavior happens, we add something to it, and it decreases the likelihood of that behavior happening in the future.
Parent gives takes away a privilege because of the no, that's taken away.
See, you are learning already. Long distance high five.
Wow. Wow, that was, fell right into that one.
But you know what, and it's good, it's fantastic that you did fall into it, because it's a nice natural example now of how easily we fall into it as professionals and how easy it can be for parents to fall into it, and helping us to learn and to be objective to then guide our parents.
It's giving a consequence, but it's not taking something.
Right. So I tend to think of positive punishment as a child hit their brother, so they were given an extra chore, and that decreased the likelihood of hitting in the future. So something was added following the behavior with the result of decreasing the behavior or decreasing the likelihood of the behavior happening in the future. Negative punishment then is a great example of what you just said, taking something away that results in the reduction of the behavior or the likelihood of the reduction of the behavior. So one thing that's tough about reinforcement and punishment is that whether something is a positive punishment or a negative punishment is relying upon the behavior changing. So even though we want a lot of things to be punishment or a lot of things to be reinforcement, it's contingent upon, did it affect the behavior? If it's affecting the behavior, then it may be a reinforcement. If it's affecting the behavior, it may be a punishment. But we have to wait and see the effect on the behavior to know, was it reinforcement or was it punishment? Okay?
Can you give an example just quickly?
Sure.
That, and I didn't catch what you had said.
Oh, I'm sorry. So one example of negative punishment, would you mind repeating your example of negative punishment?
Yeah, it's when a child hits their brother, does something, and the parent removes a privilege, so they lose something in order to promote them stopping it.
So a behavior occurs, something is removed. So a behavior occurs like hitting. What's removed might be a privilege.
Like TV tonight.
Like TV tonight. And if the behavior decreases or the likelihood of the behavior decreases, then that was negative punishment. Something was taken away to reduce the behavior. Of course, the contingency there is the behavior must reduce, or else that wasn't a punishment, no matter how well we were intended in taking something away. And same thing, we add something like an extra chore with the intent of reducing the behavior. The contingency being the behavior needs to be reduced for that adding of the chore to have been a positive punishment. So I want us to keep this in mind, because when we're talking about punishment strategies or punishment skills, these are skills when examined across a range of children have been found to typically be effective punishers or typically be effective reinforcers, but we need to be savvy therapists and savvy treatment providers to know, does the application or does this specific skill work for this family? Yes?
I was going to give an example.
Please.
Of it not working, maybe, if you take something away. Some kids, the parents will say, well, I'm going to take something, I'll take your TV away if you, you don't, do your homework. And the kid says, I don't care, and really doesn't care, and really, continues to not do their homework.
Yeah. So the parent can keep taking it away and get angrier and angrier and angrier, but if it's not reducing the behavior, you're right, it's not punishment.
We sometimes, when we're teaching parents, have tried to use language similar to what you're doing. Is would this be a positive reinforcement for the child? Would this be rewarding from the child's experience? So positive reinforcement would be a reward for the child if it's from the child's experience. And a negative reinforcement would be relief for the child from the child's perspective. And that builds in, you only know once you apply it.
Right.
And the positive punishment would be punishing to the child from the child's
perspective,
experience. And the negative punishment would be a loss to the child from the child's experience.
I think that's a really
The words reinforcement
are
so
tough, yeah.
confusing
Yep.
in a parent training situation.
Was everyone able to hear what she was saying, the language that they use with the child? So what's been a loss for the child, or what has been something that happens to the child from their experience that has been a punishment. So getting parents to generate things that have typically worked, but using different language to make it more accessible to parents.
It gets across the notion that anything we use will be individualized, because we need to start from the experience of the child about what is a reinforcement, and if it's a positive reinforcement for the child, then it would be rewarding from the child's experience. We won't know until we apply it and see what happens to the behavior. If it's negative reinforcement we're intending, we won't know if that's the case unless the child is experiencing it as relief. So when we try to get the parents in the child's shoes, they can sometimes turn around and say, well, that really isn't relieving for the child. It's actually it's actually a punishing for my child.
Yeah, so it's not relieving,
Yes.
it's
Yes.
something that would be aversive.
It's a way of reducing the amount of language, actually, because of those developmental considerations, not just for the parent, but even when the parent talks to the child. But then negative reinforcement would be a relief, whereas negative punishment in the child's experience would be a loss. I don't know, a loss of something that the child would otherwise find rewarding. Right? It's from not only the intention of the parent, but going back to what the experience of the child is.
Yes.
But I think one of the things that I found over the years, and I'm a little grayer than most, than all, is that what's missing in what you're saying is the knowledge that you're giving the child a choice.
No, I don't know, the parent is
No, let me finish.
Oh, sorry.
No, you're giving the child a choice. If you don't do your homework, I take this away. That doesn't mean I have to do it. And when you have a resistant child who is caught up with, you can't make me, then you can pile on, which is what discourages parents, punishments. And it ain't going to get through to the child because the child is omnipotently involved in, I will show you, you can't make me. My want is more important to me than what you want of me. And therefore, that affects the relationship because here you have a parent who is emotionally involved with this child, not a teacher. Teachers are emotionally involved, but parents are deeply emotionally involved. If a teacher says, I'm deeply, there is no comparison between a teacher and a parent. And so you have a child who is actually following through, carrying out what the parent is saying. It's like a child who once said to me, before I saw you, my parents would give me choices. And when they gave me choices, I would weigh them. And he said, he'd get into fights. And one day his mother said, if you get into one more fight, there'll be no birthday party. So he goes outside. He was 10. And a boy throws a ball at him. And it hits him accidentally. And he picks it up and he glares at the boy. And then he thinks to himself, because it's important to know, how does that child think? I guess there'll be no birthday party. So it was a choice that he felt was given to him. And in that case, there was no way that birthday parties were going to necessarily be enough to get him because he was heading off to a special school. I don't know if I'm making sense, but I think it's important to clarify.
I think what both of you are bringing up is, again, strategies that you have found helpful in the implementation of these behavioral principles, and also echoing the importance of things like the frequency, the intensity, the considerations of not only the kids with whom you're working, but the families with whom you're working. So I appreciate all the feedback that everyone's providing. A few other things. Here's Extinction for you, so hopefully I do a good job covering it, that I want to bring up with consequence. So we talked about consequences as reinforcement or punishment, and said that generally consequences can be divided into those two general categories. Another that I want you to be aware of is extinction. And extinction is different than punishment. Extinction is the cessation or stopping of something that had been previously reinforcing that results in a decrease of the behavior. So I'll talk through these examples and then we can talk about this concept in a bit more detail. So if a parent previously gave attention, let me stop right there. So if you're giving someone attention, is that a positive or a negative strategy? Not subjectively, just in terms of it's positive. Okay. So a parent previously gave attention to a child every time they whined. and realized that the attention reinforced or increased the whining. We had been positively reinforcing whining by providing attention after the occurrence of whining. So that's the situation here. The behavior was whining. The consequence was attention was given afterwards. The whining was increasing. The parent realized it was reinforcing, and they were positively reinforcing the behavior. Again, I'm just making this distinction so we begin to understand positive versus negative reinforcement. The parent stopped or ceased giving the reinforcer, which in this case was the attention, and then the whining decreased. So we can see behaviors extinguish or go down dramatically by stopping giving the previous reinforcement or ceasing what had been previously reinforcing. Yes?
I think this is really hard
To
with certain behaviors,
Mhm.
people disrespectful,
Yep.
talk to a parent, for example, or something like
Yep.
that I think parents feel if they don't respond
Yep.
to every time.
They're not doing their job. Yes.
That they feel that if they don't stop that behavior by saying it,
Mhm.
saying, no, you're being disrespectful, they don't realize that they are reinforcing it.
Mhm.
And that one of the things I try to tell my parents that I work with, or anyone actually, if they want something to stop, and I teach my kids that the kids that I counsel, you have to ignore, and I show them what it means to ignore.
Mhm.
Even by turning their face away, like, zipping their mouth, whatever. And it's a very difficult skill to teach
Mhm.
to parents because
Yep.
they're stuck in that role of, I'm not going to let my kid talk back to me like that.
Yep. And let me move in right now if I can. I promise to come back and to get your question or to your comment. So extinction is failing, or not, I'm sorry, not failing, but no longer giving what had been previously reinforcing. In this case, attention. So that is extinction. I also want us to be aware of what an extinction burst is, specifically because you brought that up. Have people heard of an extinction burst before? Okay, some have, some haven't. So sometimes what we see is, I wish I had a board I could write on for you, but oftentimes we'll see, if we graphed out behavior, we would see a line like this. So over time, the behavior lessens or the frequency of the behavior decreases. And it looks kind of like a general line down. We think, yeah, our program's really working. Other times, when we intentionally stop providing what had been reinforcing to the child, we will see an increase in behavior for a short-term period of time. And that kind of makes conceptual sense to me, because the way I understand it, though I would be happy to hear from others, is if a child whined, and they had been given attention before, and whined and attention, and the behavior was increasing over time, they had learned a pattern. I whine, I get attention. Disabusing ourselves of what value we place on whining and just looking at it objectively. I whine, I get attention. I like attention, I'm going to keep whining. So all of a sudden that reinforcer, that attention, is removed from the situation. And I can see where a child might say, oh, I just whined. I didn't get a reaction. I usually did. Perhaps I wasn't heard. I'm going to whine a little louder or a little stronger. Still I'm not getting that reaction. Perhaps this always worked for me in the past. Let me ramp up the intensity of my whining. Let me ramp up the intensity of my whining until eventually it's no longer reinforced, and we see a pretty dramatic drop-off in that behavior. Another example might be if you had a rat or an animal who every time they pushed the lever, they got a pellet of food. Push the lever, pellet of food. Push the lever, pellet of food. Push the lever, no food. Wait, push the lever, no food. Push the lever, no food. Push the lever, no food. That can't continue forever. Eventually the animal learns, I no longer get food from this lever. I'm going to have to look for it in a different way. Or I no longer get attention from whining. I'm going to have to look at it in a different way. But we will sometimes see the increase in intensity or frequency of the behavior when what had been previously reinforcing has stopped. And again, this is important, I think for that reason that you mentioned, is that setting parents' expectations for what the likely outcome might be. You might either see slow change, or in some cases, we'll see a really dramatic increase in the behavior and an equally dramatic drop off in the behavior, can help them to know, is this just something I need to ride through, or is my program not working?